We are.
Hello, welcome everybody to another Holistic Vet Sisters, 6 o'clock on a Thursday evening, UK time. And we're here to support you with some answers to questions that you've asked us. We've had a lot in our messages this time, so we would encourage you to try and use the comment platform as well. Apart from anything, it's easier for Tina to find them. But yeah, they just they're really useful because then people that might wonder the same thing can see that that question has been asked, and also as we're chatting about it, it makes a little bit more sense for the viewer as well. But anyway, we're grateful for the questions, however, and we're really keen to help you. So we're here, as I said, on a Thursday at 6 o'clock, and today we've got Dr. Lise Hansen with us over in Norway. We've got Tina Purple.vet, but she's not in Norway. She's over in France at the moment on a bit of a holiday. And
That's 2 out of 2 countries wrong, but that's all right.
In the UK, from the APNC to talk about nutrition. But Tina is going to do a conjuring act, and she's going to conjure up another wonderful holistic vet for you.
Yeah, so Lisa is still in Denmark, and I'm actually in Switzerland now with our guest today.
Oh, you're in Switzerland? I thought you were in France. Sorry.
Oh, we're in Switzerland. Victoria is living in Switzerland. Yeah. So yeah, that's where she's speaking French, and she's helping her clients in French and in English.
And trying to convince you to learn French, Tina. Because Tina's boyfriend, who's also with me visiting on vacation, he's actually French. And she doesn't speak French.
It's a very difficult language.
Well, so is Norwegian, I think.
No, it's
very... Tina, there are 3-year-olds speaking it fluently. Come on.
Oh, come on. I learn it. After I turn 30, you can do the same thing.
This is not fair, Lisa.
But Victoria, am I right in thinking that you have started a podcast similar to this one, but in French?
I have, yes.
That's amazing.
Once a month. Because honestly, I don't know how you ladies do it every week.
There's 3 of us. It helps a lot.
But yeah, she's not a vet, so she's a, let's say, lay person, but she's very, very, very involved in natural medicine. She's not a naturopath, but we could call her that. And she's been running a website called Vis Medicatrix Natura for like years. And she has helped heal a lot of dogs and cats and animals using natural medicine and avoiding Western medicine. And she's helped a lot of people individually. So she takes different cases. And so we started a live together. And so far we've talked about parasites, so heartworm and leishmania, because she lives in Greece. So it's something she's confronted with a lot. I'm in Switzerland, but a lot of people, they travel south in the summer, and they actually, like, I've been to Corsica a couple of times, and if you don't think about it, actually you don't think about the risk, and there is a risk. More than half of the dogs in Corsica are infected with leishmania. That's massive.
Wow.
Yeah. I actually had a student whose dog came over from Portugal and had leishmania. Yeah, very interesting. It was a sort of a 2 to 3 year journey that they went on, completely going down the route of natural dog care. They worked with Vince the vet, and he was on various supplements, the dogs, and in the end the reading showed that the leishmania had gone. So she worked very, very hard over the course of that time period to really support her dog and to clear this, which is, it's generally they die and they've still got the reading showing it's there.
It's a really complex disease, and it's a difficult diagnosis, and it's not a very effective treatment. And it's I mean, I have this conversation a lot with people wanting to travel south with their dogs, that you really have to be aware of this. And in my world, it's just another argument for leaving the dog at home if you possibly can. It's there's a lot of
in terms of Zoo Farmer, what was really interesting is towards the end, when she started getting the readings that he wasn't this had gone, he was drinking lots of seawater. So she used to say, why is he drinking seawater? And this may or may not have had an impact, but a lady that I follow about water, she talks of seawater as having certain microbiome within it, certain biome that is supportive to us. So perhaps there's a link there. It's just a crazy thing that she was noticing.
In Chinese medicine, we're going to use salty foods to treat kidney stuff, to treat water element problems. So yeah, maybe there's something like that. And leishmania can affect the kidneys, among other things. So maybe it was a visceral case. But what is interesting, what is, I think, problematic with leishmania is that it can take 2 years for the dog to test positive. What I see being in mainland Europe is a lot of dogs that are adopted from further south, like Portugal or Greece or Spain. And these are people that they want to help these poor dogs that need adopting, and they have massive, massive hearts. And then I see them and I like go through the paperwork and I'm like, okay, well, it was positive for leishmania, it was positive for heartworm, it was positive for this and this and that parasite, or even that they weren't positive, but we need to keep testing them. And these people, they're not prepared for it, and it's costly. And people generally are the lower income people that they want to help everyone, not to generalize, but it's often the case. And then they welcome this dog into their home, open arms, big hearts, and then they get stuck with these massive vet bills because they just didn't realize what they were getting into. And those adoption people, they're not telling them. It's a big problem here. And unfortunately, I see it a lot. But yeah, so Nelly and I have started doing that. And it's quite fun because I bring the vet side and then she brings the more natural side. And yeah, so far it's been a big success.
What is the name of this? Just in case anyone has any friends in France, they want to...
Right now, it's being run on the Facebook page of DR Victoria, Vétérinaire Holistic Vet. And then once it goes off, like we are putting it on my blog page, which is drvictoria.vet. So it's
why don't we put the links, Tina? You're together, you two. You can do it. When Tina's going to put this video up anyway and put it on YouTube, why don't you put the links?
Yeah,
perfect.
To Victoria's.
Actually, I have an interview with the lady who cured her dog of leishmania. It's on my YouTube. It's on my Spiritual Dogs YouTube. Yeah, I'll put the link.
And Nelly, actually, she cured her dog of heartworm.
Oh, brilliant.
Took 7 years.
Wow.
Heartworm.
What a journey. 7 years.
And no Western medication.
French heartworms.
No, Dirofilaria.
Oh, okay.
Yeah.
Wow.
Do you have that in Switzerland? I mean, do you see that? No, we don't, but only from people who are traveling. Luckily,
Okay.
we get it here. But it's very present in France. Yeah.
Really?
Mm-hmm. And Southern Europe. All these tropical. Well, exactly. But they are. I think of it as an American thing. But obviously, hot climates. Yeah, it's interesting.
Yeah. Well, talking of tropical, we have a question about lepto, don't we? Lepto vaccine. Should we do that one? The lady emailed us on our messages, and part of one of her messages involved the dog having the lepto jab, a home visit. The vet did a home visit, and yeah, the lady's given a list of things that happened to the dog very shortly after that, and she's wondering whether it can be linked to the symptoms can be linked to the lepto vaccine. Have you've read those? I think we all have a lot of feelings on lepto vaccine here. It could be. I mean, the general gist of all of us is it could be, I think. I see a lot of subclinical disease that normally shouldn't be directly attributed to a lepto vaccine that becomes apparent because of the immune stimulation of the lepto vaccine. I think that's a fairly safe response, like a safe answer that I see a lot. But yeah. And the problem is that there is no test you can do to diagnose vaccine damage. There's no list even. I mean, the WSAVA have tables of known side effects, but it's not a complete list, and they say so themselves. And if you read the WSAVA reports on vaccination, they are very clear that side effects happen. They are grossly underreported, so we don't know how often they happen, and they can take lots of different forms, and they can happen, the way they put it is days, weeks, months, or years after the vaccine that directly caused them. So it's impossible to be sure. There's no way you can know. Anything could really happen, but it's certainly always worth reporting any
any unfortunate things or changes that happens in the weeks after a vaccine, but a side effect could occur a year later, and you just have no way of knowing. So you really need, you know, huge statistical analysis to be able to know. And in the individual case, you can't know. So it's sort of an unanswerable question, but it certainly could happen. And it's a vaccine that has to be, you know, approached with great care.
And I think this dog had lost the use of its back legs very shortly afterwards. Maybe a little bit of incontinence from what I can read. So that they sound quite extreme things if the only change really has been this home visit and this.
They're not,
but sometimes it is.
But they're not symptoms we classically see with lepto. So if we're talking about vaccinosis and that kind of thing, that's not the symptom we would expect to see.
That's an interesting point, Victoria, because we tend to just think, oh, you know, that if they're going to get vaccinosis, or, you know, all things could be related. But actually, the vaccinosis would be related to the symptoms of the disease that they've just...
not necessarily at all.
Oh, interesting.
No, I would agree. I would agree.
That's what I took from what Victoria said, but that's okay. So it's not.
No, I don't agree with that at all.
It's one way of looking at it, but I don't think that's the only kind of side effects that we could see. But if we're trying to say it's the fault of the lepto vaccine, there's a lot of discussion about vaccinosis as a subject, let's put it that way. And typically we look like the distemper vaccine, we're expecting to have neurological things. So if I applied the same theory, then maybe we would see lepto kind of symptoms. But I'm also aware that we would potentially see other signs. But why would the lepto vaccine cause a dog to suddenly become ataxic and incontinent?
Oh, that's well described, though. If you look at the WSAVA report, seizures, for instance, seizures, ataxia, I think even ataxia is mentioned as a general vaccine side effect. So I mean, it's often not the disease component. I mean, it's the killed vaccines that cause the most problems, and it's the adjuvants in those vaccines that cause the problems most of the time. So I don't see a link, and I don't really see why we would expect to see a link necessarily between the disease and the ill effect of the vaccine. I mean, one of the well-described side effects, very acute, very violent side effects of a lepto vaccine, for instance, is autoimmune hemolytic anemia, which is not, you know, not to do with lepto, but it's a side effect that's been well described from the vaccine. So I think my answer,
any vaccine,
any vaccine. But I've just seen the papers I've seen were lepto, but it could be any vaccine. I'm sure.
But the thing is, we're trying to attribute those symptoms specifically to lepto, but actually there's symptoms that could be related to any kind of vaccine or anything we do, which might stimulate the immune system, because that's what vaccines do. They stimulate the immune system, and then there's other toxins that are in the adjuvants and so on, which cause issues.
But the frustrating answer has to be that it could be a side effect to the vaccine, but there is no real way to know. There's no test, nobody can say for sure either way, but I would certainly say that you can't rule it out.
Yeah. And I know we probably this is probably our 10th live talking about lepto. So there's a question here for Lise, which I think you probably answered in the past 3 lives about lepto. But someone's asking if lepto nosodes are useful and effective.
Oh,
we've had that one before, and I think they can be if you're in a high risk area. We talked about this when Vicky was on, and she apparently, you know, uses them regularly. I think if you have a dog that's completely healthy and you're not treating it for other things, and you're in an area where you know that, you know, if a dog from your, I don't know, your dog training class or your neighbor's dog or someone in the area, if you know for sure that there are cases, then I would think a lepto nosode was a good idea. But I don't think all dogs everywhere should be taking lepto nosodes on a regular basis if they live in a country where, like I do, where there's maybe 5 cases a year and the risk is negligible.
But isn't there a study that came out of Brazil where they get a lot of flooding and they get an increase in cases, including in people, and they actually at some point they used leptonosodes to prevent those people at high risk of getting sick, and it seemed that the statistical analysis showed that it reduced the incidence of disease.
There was a very impressive study done, absolutely. And I think if you're exposed then I would use a leptonosode. If you're exposed to kennel cough, I would use a kennel cough nosode, but I wouldn't do it all the time. You know, if you're in a place where it doesn't really happen, you've never met a dog with lepto, your vet has never seen a dog with lepto, then I don't think your dog's going to benefit from being given a leptonosode on a regular basis. But if there is known exposure, I absolutely would.
But I think you just said something really, really important, Lise, and it's the dog in good health. Because what I see is a lot of sick dogs or sick animals where the owner wants to start doing natural or holistic or integrated or whatever you want to call it. They suddenly have this realization that maybe Western medicine isn't what they want anymore, or they feel like it's failing. It's often older patients with chronic disease that's very deep. And then they come and they want me to, like, with a Western approach, like, give them some amazing magic wand and fix the dog. And I'm like, okay, but there's this and this and this and that actually led to this pathology and this chronic state and these diseases that are like one after the other. Like, okay, we need to step back and we need to figure out what is the most important, and then we need to go from there. And like, one of the first things I always do is look at food. And I know you discuss food, like, it's like, yes, it can fix a lot of things. It doesn't fix everything, but what is a healthy dog? And genetics has a massive role, I'm pretty sure of it. And we talked about this today, Tina.
Yeah, we did.
And transgenerational stress as well.
Epigenetic stress, absolutely.
But we need to be realistic about what we expect from holistic medicine. It's great for prevention. It's great for treating things, but sometimes I think expectations are unrealistic.
Especially that there's this, sometimes I find an expectation that is almost like, but surely it's almost magic. You know, I mean, if you have a chronic, like I had a I don't know, 12, 13-year-old little dog with at least 5 chronic conditions, had been going to the vet several times a month for years. And I saw them back and it was maybe 20% better. The skin had completely cleared up, but the knees still hurt and the kidneys were still, and, you know, there's lots of different problems. And I said, well, that's great. And she went, but she's not, you know, I was expecting something more dramatic and magical and kind of, you know, and it's just like, well,
we'd be very, very rich women. Wouldn't it be cool?
Sure. And then the other, I mean, sometimes it is. I had another conversation today with someone who was going, I can't believe I give this tiny little sugar pill and the next day everything is better. But that is because we spent a year finding out exactly what is the tiny little sugar pill that dog needs. And now it works wonderfully. But sometimes there is that expectation that, you know, I mean, I hear people who've been to a homeopath once, maybe twice, and they say, oh, well, we tried that. It didn't really cure things. And I'm thinking, well, do you take that approach with your own doctor or even your conventional vet? I've been once or twice and we're still ill, so we're going to give that up. You know, it's like, it's a process. So, you know, I think that's a really good point, that we need, it takes time and it takes work and incremental improvement if it's a very long-standing chronic problem or or several of those even.
And like cancer, it's very difficult to cure cancer. I'm not saying we can't, and sometimes we do have those kind of miracle cases, or like I had this liver carcinoma case, and the dog came into me. He'd been diagnosed, he'd been operated, exploratory laparotomy. They opened up the dog. They looked inside, nothing had come up on other imaging. They looked, and then they said, okay, we can't do anything, close him up. So they closed up this dog with this massively aggressive liver tumor. I mean, they took biopsies, okay? And he arrived in my office and he's like vomiting, he's not eating, he was super sick. That dog lived for 2 years. Did I fix his liver cancer? Absolutely not. But I managed it. And
sometimes you get the dramatic cases. I mean, I've got several patients that were, you know, dying and were cured, but I've also got cancer cases that couldn't be touched, couldn't be helped at all.
Yeah, I've had others where I've tried everything that in my power and knowledge to do. And did I increase life expectancy? Maybe. But did I fix a dog or give more than a few weeks? Absolutely not. It's tricky.
Yeah, no, absolutely. But yeah, I mean, I think most animals benefit, in my experience, particularly if the owner is committed to the process. You know, we'll come back monthly, maybe 5, 6 times, and then we'll see where we are, rather than come in and then expect everything to be magically cured immediately. That's an unfortunate
It
way
all
to approach.
depends what state the body's in, doesn't it? Because it's about the state that the body has got into, and the body sometimes can shift and transform its state to a better frequency, to a healthier form of communication, and it can start to methylate properly. And then, of course, even if the genes are there for certain things, they're not going to get tagged. They're not necessarily going to express within that state of being within that creature. So, sometimes some of the strongest symptoms we see, underneath, actually, the dog is quite healthy, or the animal's quite healthy. But so then we deal with those symptoms, and things can happen quicker, I guess. But it is about getting, at some point you have to get the fundamentals right, like diet and detoxification and things like that. You do have to do that. So even if you're approaching this, like these two dogs that the lady's asking, they're both much older, aren't they? So it's never too late to start to shift the state and to start to create this communication, this body-wide communication, because that's what they need, really.
Should we get started on the questions?
Yeah, let's.
Yeah, so have you got more questions other than this dog?
So I got two here, and then it's a couple more in the chat. So there's an Adele that was asking a question to support her dog with detox processes. So particularly after a very, for example, eventful day. So her dog ingested lots of sheep poo after crossing a meadow where sheep had recently been on the way to the vet. And then when they came to the vet, they received antibiotic ear drops for 2 weeks. And then she's now, so I guess there's two questions in here. She's now worried about the effects of the topical antibiotics on the dog's body, as well as the effect of any medication or pesticide that may have been in the sheep poop. And just to add, she writes, I'm doing the work to treat my dog's underlying problems that led to the infection, and I'm only using antibiotics to address the current infection. So I guess there's two questions here. How and when to detox, and why, and then maybe the effect of drugs like antibiotics used topically on the body.
So it's this lady in the UK, because obviously we're talking about medication that a sheep may or may not have had. So we don't know. It's going to be slightly different allowances, because, for instance, they do encourage worm counts in sheep farming over here, for sure. I don't know much about the rest of the farming elsewhere, but they do that because they don't want there to be lots of worm medication on the ground. So it may be that there are certain medications that aren't going to be with, this lady might not need to worry as much about the sheep poo eating as she thinks. That's what I'm trying to say.
And I think also that by this stage the dog will have either got ill or not, and hopefully not from having eaten the sheep poo.
I think eating sheep poo.
Well, I mean, obviously, coprophagia. I mean, they're going to do this a lot.
A lot of dogs love sheep poop.
And horse poop. That's even more delicious.
I mean, the thing is, we think it's horrid, but actually, it is full of microbiome that benefits them. So at times, if they're doing it, it is more than likely because it's of benefit to them.
That's my question. Why are they doing it? Of course, they're selecting it. But what else is going on? That means
exactly. We need to be looking at the biome. Yeah, for sure.
This dog had an ear issue or a bilateral ear issue. I don't know if one or both are affected.
It probably has dysbiosis.
Then it's a skin issue for me, which means we should look at the gut. We should look at the food. Actually, it's all linked. So the question I always think is like, okay, but why? Why are we eating sheep poo? Why do we have an ear problem? What is going on underneath? And because there we go to the Western approach and we're putting topical antibiotics, and it's obviously got to a point where they needed those topical antibiotics. But how do we get to that point?
I don't think the topical antibiotics are a huge issue, all depending on what you do afterwards. I mean, you can put good bacteria back on the skin. You can encourage that to happen. So there's products out there that you can spray onto the skin or put into the ears, which will encourage a better biome back in the skin where you've used topical antibiotics. And the very fact that the lady's questioning it, I hope she will find different things next time.
We talked about this today, Tina, because I have a practice which is, I would say I have clients that are much more holistically minded. That's why they come to me, because that's what I'm doing. and you've been working in some more Western type practices. And I don't see a lot of advanced stage ear disease, for example.
I do a lot every day, every single day. And it's like 10 out of 10. It's not like 1 out of 10. It's like really bad.
And a lot of my ear cases, I manage with cleaning and actually with Manuka honey. It's
Oh, love that. Yeah.
Antibacterial. It's a really great anti-mycotic. It calms, it helps natural healing, but you need to choose your cases. You know, I've also had like a case a while back where the dog came in, had already seen the vet on emergency. They've been trying to treat the ear, and it was an Akita that was aggressive, that even with the muzzle, it was impossible to imagine putting an otoscope down the ear and having a look. And I said, listen, if it's not improving, I need to sedate the dog. And we sedated the dog, and it had a foreign body in its ear. And in most cases, it doesn't matter what you put in the ear to treat it, you need to get the foreign body out. And so if I never did the sedation, then we would never have treated the dog, and she would have suffered for however long. And sometimes it's difficult. I mean, who likes having an otoscope in their ears, honestly?
It's very hard when they're awake sometimes.
Yeah, but also, I mean, I've been doing this long enough that going back, it will be a matter of, you know, get the bodybuilding nurses in, and we'll hold the dog down and we'll muscle it and we'll look in the ear. But I mean, that's an assault. You know, it's much kinder to sedate them straight away, have a proper look. But I think it's a really good point again, and I think it's the reason why I'm always a bit uncomfortable when we get these questions about what should we put in my dog's ear and I think it's just the wrong question. Depends on the ear, depends on the dog, and we got to rule out foreign bodies in the ear. We got to know if the eardrum is intact, and we need to look at that ear properly. You know what's in there. And dogs with recurring ear infections have got, I mean, it's how you show an allergy if you're a dog. So we need to get to the immune system. And of course, I'm going to say homeopathy does that like nothing else, but I know acupuncture can as well. But we got to get to the underlying problems.
The root cause.
Yeah, exactly. Yeah, that's how we cure those cases. Definitely. But that's a good illustration. I remember when I started learning homeopathy, Chris Day, as a sort of warning, presented a case where it was a cat that was salivating profusely, and you know, how could we treat it? And people were looking up in their books and remedies for salivation and what could we do. And then he said, well, actually, if you opened the cat's mouth that had a fishbone stuck in its palate, you know, and it's just like, you need to examine the patient. You need to make sure that you know what you're treating. It's no good to be at the end of a Zoom call prescribing all sorts of stuff if no one's actually examined the animal properly and found the foreign body or the problem.
I actually had a case recently in a cat, and it was my nurse's cat, or her family's cat, and he hadn't been eating, he was salivating, she was concerned about him. And so I came in, clinical exam, unsedated, looked in the mouth, looked at the back of the throat, palpated the abdomen, found this mass in the abdomen. I'm like, okay, x-ray. So we took the cat to x-ray. And then x-rays are very difficult to really diagnose foreign bodies. But it presented on the x-ray, it was very suspicious of a foreign body. So I phoned my local clinic and I said, listen, I have a suspicious case of a cat with a foreign body. Can you take it? They took it. I wanted them to get an ultrasound because it is a better modality for these foreign bodies, but even then. So they ultrasounded the cat and they said, oh, it looks like a linear foreign body, which is quite problematic. So let's take it to surgery. They did that. They didn't find anything in surgery. They didn't open up the intestines, but they didn't find a foreign body. So then they were thinking maybe it went into the colon, and let's see what happens if the cat poops it out. Anyway, the cat had the surgery, but he didn't get better. And he still didn't get better. And the wound was healed. He was doing fine. He's still salivating and not wanting to eat. And I said, listen, like, actually what I did was, because they came in, like, so I could have a look at it again, I said, we really need to do a sedated exam, and probably we should think about doing endoscopy or rhinoscopy or looking otherwise at what's going on in this cat, because I just don't know. And because I do acupuncture, and I also did chiropractic on the cat, but that's a different story. And so I put some needles in for what I was seeing from a Chinese medicine perspective. And the cat went home, and the next day he started bleeding from the nose. So actually acupuncture helped me. It gave a signal to the body to try and expose something. And as it turned out, a few days later, and thank you to the representative that came in, she wanted to sell me an endoscope. And I started talking about this case that I wanted to have an endo and rhino on. And she said, listen, can I lend you the equipment? And I was like, oh my God, this is so nice. Thank you. So we anesthetized the cat at the practice, and I put the scope in, and it had this piece of grass like this, like hanging around, that we couldn't see it without doing the sedated exam. And it must have been like flipped up into the sinus. And so the acupuncture pointed me in the right direction, but I still needed the Western medicine with the anesthesia and everything else to actually go and get it out. And that cat got better after I took down this piece of grass.
And it would never have got better with the piece of grass in there still. I mean, that's...
Oh, and if I could acupuncture it as much as I want, and it probably would have got an infection and whoever, what else. And they were thinking of euthanizing the cat. They'd already spent a lot of money at the emergency clinic with the foreign body that wasn't a foreign body or that we never found. Yeah, and it was this piece of grass. So sometimes you actually need to like look at the patient, and sometimes you need to sedate them or anesthetize them to get the information you really need.
Absolutely. So just coming back on the questions regarding the effect of topical treatment, I very much opt for topical treatment over systemic whenever possible in most cases, because it has less of a systemic effect. Obviously, if you use cortisone, it does thin out the skin a little bit, and you shouldn't be on it over a longer period of time. When it comes to antibiotic ointments that you put on topically, obviously it disrupts the microflora on the skin temporarily, but this can also, you know, be added back through like probiotic products. And then she also asked about detoxing, and I don't know how often you guys recommend detoxing, but different practitioners do this differently. Some recommend to give certain supplements after an insult, like if they get a dewormer, if they get ill, different supplements. Sometimes people recommend detoxing several times a year. So I kind of wondered what you guys do in your practice.
It depends.
Do you know what though? I would be, and I try to do this, and I believe in this for humans as well. We don't necessarily always need to do a detox. If we can encourage the pet's body to be able to detox on a regular basis, it should be detoxing all the time. It's meant to be something that you do as a special event after a busy day or whatever this was. Because the body, what the point of working with naturopathy and nutrition for me is that we are encouraging the body to have its own discernment all the time in terms of what it likes and what it wants to absorb and what it enjoys and what it benefits from, what it needs, even what it doesn't need at that time. Because, you know, we can feed our dog loads and loads of a certain vitamin, or we can try to say, oh, we've given them everything they need. But if they don't particularly need it that day, they have to have a way to either store it, which obviously some things are stored, like your fat soluble vitamins, for instance, or to remove that excess from the body. So they do different things every day. They feel differently every day. Their nervous system's working differently every day. So they're not going to be using, even if we try, even with a fresh food diet to get it right, they're not going to be using everything every day in a certain way. So it's this discernment. And I think that for me is what it's about, understanding with the avoidance of repetitive vaccines as well, because the dog should be able to discern naturally what it is that they need to build an immunity for and what it is they don't need to. And that discernment is shifted constantly if we are repetitively forcing the immune system to make decisions, quick decisions. And that's what happens when they have these repeated vaccines. So for me, it isn't, I mean, I can answer the question in terms of what I would use for a detox for a dog that really needed it. But I think the big picture is the big picture. Let's get them methylating properly, which is related to detoxification. That would be my main answer. And then as an individual detox, if a dog really, really does need detoxing, it depends what you're getting rid of, but I would say I'm a massive fan of super greens, as you've heard me say before. So chlorella powders, things like that get rid of heavy metals because they bind to them and they help the body to reduce them. What else would they want to be able to be detoxing from? Heavy metals are one of the worst, aren't they? You can use certain herbs as well to try and detox. If it's like parasites, maybe you can use certain herbs. I would go to a herbal vet that can know the kind of dog you've got there and their history and what kind, because there's loads of different herbs, so it's finding the best herb. So parasites and heavy metals, for sure, you may want to do that for some reason. Go on, I'll let someone else give some answers. You're probably bursting.
The question was about a stressful day, and a stressful day.
Was it about stress? I don't know.
I come home from a stressful day, honestly, I want a glass of red wine.
I was going to say, I'm going to call it detox from now on when I come home and need a glass of wine.
Gin tonic. I mean, just And actually in China, then they put herbs in the red wine. Well, this is what I learned in my food therapy course, at least. They put herbs in the red wine to enhance certain effects. But anyway, we're not going to give red wine to the dog, okay? Please. But if I have a stressful day, honestly, what I need to do is like sit on the couch, chill, breathe, take a good book with my glass of red wine. And actually for that's what you need. Like, it's part of life. These things happen. We don't always have to go looking for complicated answers to a simple situation, actually.
I think it's a really, really interesting point, and I don't support that idea that everybody should take some sort of, one size fits all product because it's good for everybody and it detoxes. I think that becomes it's a bit of a nonsense to me, and I always get suspicious that someone's really trying to sell something here. If it's good for everything for everybody, I just don't buy it. I think if the animal is healthy, my focus would be on not exposing them to things that they then might need detoxing from. Feed them properly, vaccinate them minimally, avoid parasite products that they don't need, etc., and just try to be careful about exposing them to stuff. If the animal is sick, then I think they need very individually chosen treatment. So I don't really buy a good for everybody standard kind of detox, with maybe one exception, if you want to call it detox, which is the homeopathic remedy Thuya, that I would always give to someone who's getting a vaccine. Doesn't matter whether it's a dog or a cat or a horse or a human, or what vaccine it is. If anybody gets vaccinated, I would always suggest that they get Thuya. That's the only sort of one size fits all protective detox approach that I can think of that I would recommend.
But it's a known insult. It's the vaccine.
Yeah, exactly.
It's an intelligent response based on a known insult.
Yeah.
Yeah, I wouldn't say we argue about it because my partner is understood, but he likes to have a perfect lawn, like perfect grass. Like when it gets a little bit of a hole, he wants to fill it in with more soil and then grow more grass. And since we had the dogs and I became in his life, and I'm like, no, now we have these weeds growing in the garden, and he's quite upset about it. And I'm like, well, I'm not really happy about it, but the only thing I can suggest is when we go away for 2.5 weeks with the dog, that's the moment you can do it, because then the garden can detox a little bit itself from the horrible chemical you want to put on it. But anyway, he doesn't do it because then he doesn't have time, so we're okay.
Yeah, when it comes to detox, what I generally say is there's many things that you can do all the time to, well, help your body detox or eliminate things that it needs to detox. So for me, there's things we should be doing the best of our ability all the time. And then there are certain things we can do when there is a larger insult that is appropriate and might be custom to each patient. So, opening up the detox pathways, clean air, that they get clean food, clean water, minimize environmental toxins at home and at outside and where they are, making sure they get a lot of fresh air, grounding, movement for the lymphatic flow, you know, sweating out not keeping them in a hot car, obviously kind of sweat, but you know what I mean, like a lot of movement and helping their body in that way to detox naturally all the time, because then they are more robust and resilient when there is a tiny insult like she discussed here today. But obviously I think if there are bigger insults, like known insults like vaccines or certain medications or something like that, then I think there are definitely good things to help the body with the detoxification process. I do see a lot of pets as well that detox poorly because of all these reasons. There are so much toxins and so little detoxification happening, that then usually if you just improve all these things that we should be doing all the time, sometimes that is enough. Sometimes they need a little bit additional help. So yeah.
The basics, isn't it? It's getting the basics right, which we feel like we are doing, you know, as natural dog guardians, don't we? But Tina's so right. The basics, sometimes you do more of the basics.
Yeah, and if they're not detoxing, or if they're showing signs of toxicity, why?
Yes, why? Exactly.
What is
going on? Yeah.
I'm going to use the word pathology to explain it, but what is the pathology going on, which means that we're not detoxing correctly? Is there something going on with the liver, with the kidneys, with the lungs? And then when we look at it more holistically, maybe we're not talking necessarily about a pathology that we would diagnose in Western medicine, but we're looking at an energetic kind of dysfunction, or whatever you want to call it, blocked stagnated chi, or a deficiency of whatever. Like, these are terms that we use, an excess here, a deficiency there, 5 elements. You have a different way of explaining it, Lise. But
it's the same underlying way of thinking. You know, you need to understand where is the imbalance in this individual to be able to support them. So it needs to be more specific.
And what depth is it at? Like, are we just having maybe the spleen, the Chinese spleen, isn't functioning as well? But is it just the spleen, or is it because I also have some heart issues and some liver issues? And what is the bigger issue here, and what is the primary problem? And we have to work through those things. And if we can find the solution and understand what is the different levels of the onion and get to the core problem, then the dog or the cat or whoever it is will be able to detox, let's say, naturally, innately. You don't necessarily need to give them like loads of stuff for the liver all the time, which is something I see a lot on social media, is like, buy this liver detox.
Yeah,
sure. And it may be relevant for some individuals, but there are very few things that are just good and therefore everybody should have them and everybody will benefit from them. I would just say, to go back to this specific question, that I don't think that there's going to be much achieved by looking for a detox for this dog because it's been to the vet and had a stressful day and had the ears treated. I think the issue that it clearly is a dog with problems, and I think the person asking the question did say that they are addressing the underlying issues, but I think that's where the energy should go. And maybe whatever they're doing, I don't think the question mentioned it, but whatever it is they're doing to address the underlying issues, if it's working, then great, they're already doing it. If it's not working, maybe a sign that it's not working optimally could be that they've just been to the vet for antibiotics. Maybe it was just a bleep and they're on a good path apart from that. Then I think they're already doing it. But addressing the underlying issues have got to be where to put the energy and, you know, the focus in a case like that.
And maybe the ear problem is because this person is trying to address the underlying issues, and now we're seeing the body express it with this coming out the ears. And it's actually a key for us. It's information for us to understand. And sometimes you're better off going back to your holistic practitioner to understand what is going on and to treat that based on what we already know about that patient, than to then add this Western approach where we're sticking antibiotics. But it depends on the level of crisis.
Yeah. So sometimes it's absolutely fine to do both, but I don't think then adding a detox is going to help clarify the picture, really.
No, I think the only thing I would add here is if this is like if she means like stress, there are obviously herbs that are good for stress, but I think here she mostly talked about the detoxification. There was an additional question here in the chat from Irma. She was asking if anesthesia and sedation that detox could be helpful or not. And it's funny, if you, I think it was our last live, I also
Lucy,
what happened to our cat after
Yeah.
she
Oh, yeah.
went under anesthesia.
And I said to you, why?
Exactly.
Why?
And then I was like, you know, so obviously it is an insult to the body. So yes, anesthesia, I think, is a very good reason to help them with that detoxification process before and after.
But also you've got to think, what is it you're detoxing there? Like with a vaccine, we can say the adjuvants could potentially be heavy metals. Okay, but what is it in an anesthesia that you'd be looking at detoxing? Or is it just that we decided, as we decided last week, that the biome had been affected?
Everything. So it's the microbiome. Everything is filtered through the kidney and the liver, which then struggles to detox other things.
But what in an anesthesia specifically would you be looking to remove from the body? Is there something in it that you'd be?
I have this thing right now where and we discussed this with Tina. Actually, there's ways of doing electroanalgesia and anesthesia. And I have cases where I use a third of the sedative in specific acupuncture points. And then I use electroacupuncture as an induction. And if I need to, because it depends on the constitution of the patient, they may or may not need gas to maintain them. But if I switch off the anesthetic gas, so they never get injectable anesthetic drugs, and I switch off my electro machine, those dogs are up and running around 5 minutes later and they're eating. And my clients are like, why doesn't anybody do this? That dog did so well. And I'm like, yeah, I'm just a crazy Chinese woman in the yeah, it works. And I can give less of those toxic medications. And just in passing, by the way, acupuncture has an immunomodulatory effect. So you're naturally helping the dog just by doing that. And I think it's a super simple way for me to deal with that.
Yeah, I guess with so many vets not, I guess there would still be. I'm wondering whether we need to, I mean, you can correct me if I'm not going down the right lines, but I'm wondering whether what people mean when they say detox is, because we have this perception that something outside is the issue. And is it more that what we're looking to do is support them, to give them some nourishment, to sort of give them a bit of a sort of a pep up, you know, in a way? Like, we don't necessarily need to say, oh, there's something in them that's awful and we need to get rid of it. Do we just not need to nourish them in some way? And like you were saying earlier about, you go for the red wine for the emotional nourishment, but there'll be other ways that we can work with dogs to give them that emotional nourishment if they've had that insult. Or maybe Lucy could have had something like that, you know, that may have supported her. So perhaps it is more along the lines of something we need to give back to them rather than something they need removed.
And I think the answer at the end of all of that is that it will be a different situation each time, because that's when, I mean, that's when you can really help someone, when you know all the details of their situation and you understand how they, you know, where their imbalances are and their sensitivities and what they've been exposed to, and know the bigger picture, to be able to support them individually.
It wants to heal the body. So if they're given that time out and they're, you know, things are slower that day, more difficult with a cat, isn't it, I guess, than it is with a dog, because you tend to, okay, I'll shorten the walk, or I'll make the walk less hilly or something, you know, like. But if they're given that kind of nourishment and emotional nourishment, to really support them at that time, I think that's what we need to be thinking about doing, because inadvertently that nourishment might be something that supports the biome. So, you know, again, we're not really saying, oh, you know, there's an awful thing in them that needs to be removed.
Actually, because I'm with Tina, I can see the comments. And somebody said, Stella says, I meditate while my dog sits with me and he seems to benefit from it. Also, when I'm less stressed, so is my dog. And this is such an important point. I actually sometimes I actually do Qigong with my clients, because I see them like this and I'm like, okay, let's breathe. let's do this together. Like basic stuff, nothing special. And I often prescribe clients to go away and just breathe with their dog, or do Tai Chi with the dog, or go outside and touch the grass and the ground and have the dog come with you, and just centralize yourself and let the dog also get that from you. And we were talking about this today. We've had quite a lot of discussions actually, but I had a cat a while ago, came to see me for acupuncture for chronic colitis. And I treated the cat based on what I saw. And I couldn't tell you what I treated actually, but I acupunctured the cat. And then she came back for the follow-up like a week or 2 weeks later. And I said, okay, how's the cat doing? It's a miracle. Like I had my magic wand, I had my miracle of the year or whatever. It's a miracle. My cat's doing great. Awesome. But tell me, actually, I've had the same issues and they were treated and they were fixed. And when I was in the room with you treating my cat, I started getting abdominal pain. And now the client's in a crisis, but the cat's doing great. And actually, there's colleagues that discuss this way of like the pathogen transposing from people that live together, like your husband or your kids or your dog or your horse or whoever. And maybe it's a bit far out for some people, but I really like that. I couldn't make that up. She found it when I was putting those needles in. So yeah.
But it's also quite a common story, isn't it? That the people and the animals have the same conditions.
Or somehow related from the way we practice that we can understand it. And yeah. And
they reach the same state of being again. And energetically, this is what happens. This is what my Kano flow teachings are about. Yeah. And sometimes you just need that time and space, like you were saying, to either do the meditation, the breath work, the qigong, whatever it might be. It puts you in that time and space for things to shift and clear. And sometimes that is all that needs to happen, because everything is ultimately frequency and energy. So, you know, it is a big part of it. And, you know, you feel like you're doing nothing, but that's kind of the point. You're actually doing, your body and your energetic self is doing so much more than it's been able to do while you've been in busyness.
We're living so unnatural these days. We need to do like more measures to try to bring ourselves back down to earth. Do we have time for another question, by the way?
Yeah, no, we do. We got nearly 10 minutes. We got 8 minutes.
There's another Adele, actually. She had a question. A lot of Adeles today.
So the same one under a different name.
So I think she lives in the UK. She said, almost as if my dog listened to your live video last night. This morning, she has eaten another animal's poo that was either heavily infested with worms or maggots. I don't preventively give worms or flea treatment to my dog. In this situation in the past, I would have instantly jumped straight for a worming tablet. However, my dog currently has an ear infection and very itchy skin, and would work with a holistic veterinarian, but I just cannot afford the cost. So I am planning a microbiome test and an elimination diet, already raw fed, to get to the root cause of this. I'm hesitant to do anything that will worsen the already heightened immune system and the inflammation. She does have a worm count subscription due in 2 to 3 weeks. What would you advise in this situation?
She's already answered her own question.
Yeah, you know what I would do? I'll tell you what, this is what I do with Fusa, okay? If I am under the impression that she has eaten something that I think, not sure I would have wanted her to eat that, I actually just give her garlic in her food, because I don't feed garlic all the time. I save it for times when it's damn useful. Yeah, and that you can get the dosages. You can find, if you go on the Rodney Habib websites or wherever his socials are, you will find all his blogs, all his fun stuff, where you can read about how that study about garlic was all a load of old twaddle. You know, I use it as a really useful tool, and that is what I would do with Fusa. And she's only like 8 kilos, so she might have like one medium-sized clove, or if I really think she's eaten a lot she shouldn't have, she might have 2. But you know, that is what I would do. I mean, a beach, that's where she picks things up, which of course then I don't really know what they are. If she ate cat poo, I probably wouldn't give her the garlic, because I'm kind of thinking she maybe needs the biome today. But yeah, Victoria, you were like this. I guess you would do the same with your dog.
Yeah, actually, Nelly, you were talking about in the beginning, we talk a lot about garlic and its effects on the immune system and modulating immune responses. And one of the things that she used to treat the heartworm in her dog was garlic.
Oh,
One
interesting.
of the things in the process that she used was garlic.
Yeah, it is. It's great. I mean, that study, I mean, you know, they needed to have so much of it, really so much of it, for the dog to have any kind of like, you know, measurable reaction.
It's
It
like
was a
anything.
great amount of it.
You know, my 1 glass of red wine, that's great for me. But if I drink 3 bottles of it, then I'm really going to struggle.
Yeah.
Everything is dose dependent.
Sure. If I was to answer that question, what would I do in that situation? I would do nothing at all. And then 4 to 6 weeks later, I would do a worm count. And I think that's what she was doing anyway. So I wouldn't particularly worry because the dog ate something that seemed to be...
Depends what it is, I guess, doesn't it?
Yeah,
well, I can't see, you know, and if she does a worm count afterwards, it's going to be, she'll find out if it picked up any parasites, which is fairly unlikely.
stop trying to fix things that aren't broken.
Yes,
Like,
exactly.
another
Thank
example.
you.
Can Adele, the second Adele, can you go and do some qigong and some tuina? It's just breathing and just chill and relax, and then your dog will be better. And if he had eaten parasites, then maybe when you test him in a few weeks, you won't find any anyway.
Yeah, I think, and also it depends on like what they eat, because you know there's not that many parasites that goes from sheep poop to actually infest dogs, because usually they come from eating, you know, organs of infested organs and stuff like that. And if they did have, because tapeworm is one of those that are a bit harder to find in the fecal sampling sometimes, but if there was tapeworm in the poo, that is not the same tapeworm that infects dogs, so I wouldn't worry about that one.
Exactly. It's normally the intermediary host. You know, there's not very much stuff that you actually catch from eating a poo, even if the animal had parasites. That was exactly my point. Yeah.
Fox poo, however.
Yeah, sure.
Similar to dogs.
Yeah. It makes sense.
Yeah, it kind of does. So a lot of other feces actually don't have that many parasites that can infect dogs. They can have some. And it is a little bit complicated because not all of them are tested well with fecal flotation either. So yeah, I think it depends what area you live in, what parasitic infections are common. And yeah, but I think doing a fecal test anyway is always a good idea. Different parasites take different amount of time to show on the fecal test. So maybe doing like Lisa said, if you can wait a little bit longer than 2-3 weeks, because some parasites take a little bit longer to actually show up in the feces. So wait a little bit, take a fecal sample as usual, and yeah, relax.
Yeah,
I really like what Victoria said, you know, let's not try and fix things that aren't broken, you know. But sometimes there is this, we love our animals and we want to do stuff for them. And I think a lot of us also have this, we quite like to shop and we quite like to buy things and we like products and we like to show our love through things that we buy for those we love. And sometimes I see people with completely healthy animals with, you know, shelves and shelves and shelves of good things that they give just because they're good. And I think it becomes a bit silly. You know, let's not try and fix things that aren't broken. If someone is healthy, they don't need, I don't think health is, you know, rattling when you move because you're taking 20 supplements every day.
put the money that you were spending on those supplements that you don't need, this long list of things, in a bank account. And then when you have a problem, then you can come and see a holistic vet or a holistic practitioner or get real nutrition advice. Yeah, with like it's £5 or €10 or $20 or 30 francs here and there. It adds up.
And I think what our animals really need from us and want from us and benefit from is our time and our presence. So it doesn't really make sense to, you know, run around trying to make money so we can buy them lots of stuff rather than just be with them. Go for walks, be together, be calm, be relaxed.
Be grounded together.
Yeah.
They want is to feel that, you know, dogs especially, because they have the biggest heart per body mass, they're picking up magnetically your emotions all the time. So they will try to ground those for you if you don't ground them yourself. You need to be as grounded as possible, connect with the earth.
And you can't buy that in a box with a nice holistic looking label.
Well, unless you live in the city and you really have to pay to go somewhere where around more easily or something. But yeah.
IG classes.
So we're nearly at time.
We
Great to
are.
have Victoria with us.
Thank you for having me again.
And Tina, do we have you next week? Do we have you with us next week?
Yeah, next week. Yeah.
That's good, because I know you're heading to Australia soon.
I think we should have a series where Tina just pops up with different guests all over the world. That's the new thing.
She's showing me her practice. Yeah, she's showing me her practice as well, which is really cool. You know how all the vaccine checks work and like the vaccine she has, and I love when vets have like a freezer for like fresh food in the back.
You should put the links for all of that. Put the links for the clinic and the podcast and stuff on with this video.
That'd be great.
Thank you, everybody, and we'll see you next week.
Take care.
Bye.